All right, here we go again. There she is.
Take number 10.
There I am. All right. Nobody behind the couches? Nobody behind the couches? Nobody in the living room, kitchen, balcony, in the ceiling, in the fireplace. It's just me and her. Her and I. T for two, 2 for 2, T for 2, 2 for T, whatever it is. Okay. All right.
Okay, I've gathered all my equipment. Knock, knock, knock. Close the door behind her for privacy. Hello, my name is Jessica, my student nurse at CDCC, and I'm here to do a head-to-toe assessment on you. Is that okay?
Same.
Okay, I'm going to go ahead and perform hand hygiene and put on gloves. Can you tell me your name and your date of birth?
David Hogan, born March 15th, 1970.
Okay, do you have any allergies?
Penicillin.
Okay, your blood pressure was 120/80, temperature was 98.6, respirations were 18, and pulse was 80. Okay, can you tell me where we are?
We're in Shiloh, Georgia.
Why are we here?
Head-to-toe assessment,
And what year is it?
2020.
And what is 2 times 2?
4.
Okay, the patient's cognitive abilities are intact and the patient is alert and oriented times 3. The patient is sitting upright. The mood seems to be appropriate for the situation. Speech is not slurred. Hygiene is appropriate for the situation. The facial expression shows no outward signs of anxiety or panic. Okay, I'm going to go ahead and start inspecting your hair. It is evenly distributed. It is brown. There is no lice present. It is round. I'm going to go ahead and palpate. The scalp is mobile. There's no lumps, no bumps, no lesions. I'm going to go ahead and palpate your temporal artery. It is a +2 bilaterally. I'll go ahead and do your carotid artery. It is a +2 on each side. I'm going to go ahead and auscultate your carotid. Take a deep breath and hold. Okay, take a deep breath and hold. Okay, there is normal sounds. I'm going to palpate your brachial artery. It is a +2 bilaterally. Your radial artery is a +2 bilaterally. Femoral artery is a +2 bilaterally. Popliteal arteries are +2 bilaterally. The posterior tibialis is a +2 bilaterally, and the dorsal pedis is a +1 bilaterally, a little diminished. There is the skin of the face is consistent with ethnicity. It is warm and dry, no lumps, no bumps, no lesions. The skin turgor is normal. Go ahead and open your jaw for me. Okay, no sign of crypsis, no sign of TMJ. I'm going to go ahead and palpate your pre-auricular lymph nodes, your post-auricular lymph nodes, your occipital lymph nodes, your cervical lymph nodes, the submental lymph node, and the submandibular lymph nodes, and they're all non-tender and non-palpable. Go ahead and palpate your sinuses. Any tenderness? No tenderness, no edema. Okay, I'm going to go ahead and do your ears, your auricle, your tragus, and your lobule. There's no skin breakdown present. Skin is consistent with ethnicity. Is there any tenderness?
Nope.
No tenderness, no edema, and no drainage. Go ahead and include one of the ears. Tell me what I'm saying. Touchdown.
Touchdown.
Do the other one, baseball.
Baseball.
Okay, the patient passed the hearing test. Okay, I'll go ahead and inspect your eyes. They are symmetrical, parallel. The conjunctiva is pink and moist. Sclera is white. I'll go ahead and look at the ear. Okay, so the pupils are round, equal, and reactive to light. Keep your head still, follow my pen light. The eyes are accommodating. Keep your head still, follow my pen light. Okay, the patient has all 6 cardinal fields of gaze, integrating cranial nerve 3, 4, and 6 are intact. So the nose is midline. Is there any tenderness?
Nope.
No tenderness. There is no drainage. You can look up for me. Okay. No drainage. Go ahead and include one nares. Go ahead and do the other one. Breathe normal. The patient has full patency of both nares. Okay, so the lips are midline. They are pink, moist, not cracked. Get out my tongue blade. Okay, open your mouth. Say ah.
Ah.
Okay, so the uvula is symmetrical. It's midline and rises symmetrically. The tonsils have no exudate. The hard and soft palates are smooth and pink. The tongue has no lesions. There's 32 teeth, no caries. The buccal mucosa is pink and intact, and the gums are also pink and intact, and the gag reflex is present. Go ahead and push up against my tongue and to the sides. Okay, and the tongue has normal strength. The gag reflex checks for cranial nerve 10, and the tongue strength is normal, indicating cranial nerve 9 and 10 is intact. Okay, go ahead and I'm going to take my gloves off, perform hand hygiene. Okay, go ahead and close your eyes for me. Tell me where I'm touching.
Forehead, cheek, chin.
Okay, the patient has full touch sensation, indicating cranial nerve 5 is intact. Go ahead and smile, frown, blow your cheeks out, close your eyes tightly, and lift your eyebrows. Okay, cranial nerve 7 is intact. And I'm going to inspect the neck. The trachea is midline. Go ahead and swallow for me. So there's no goiter. On the neck, the skin is consistent with ethnicity. Go ahead and push against me. Push against me. Okay, the patient has full strength of the neck. Go ahead and look up. Look the other way. Look up, look down. Patient has full range of motion of the neck. Push it up against me. When the patient can shrug shoulders against resistance, indicating cranial nerve 11 is intact. Okay, I'm going to inspect the arm. Skin is consistent with ethnicity. No lumps, no bumps, no lesions. We're going to palpate. There's no tenderness, no edema. I'm going to check for skin turgor. The skin is elastic. I'm going to inspect the palms of the hands. The hands are, there's no lesions, no edema, capillary refills within 2 seconds. And then we're going to abduct your arm. Abduct, 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 and I will, there you go, all range of motion, flip it over, spirit fingers. Okay, patient has full range of motion of the upper extremities. Hold your arms up, pull against me, push, pull in, push out, push up, push up, push down, and squeeze the fingers. Okay, the patient has full strength of the upper extremities. I'm going to inspect the chest. The patient has skin is consistent with ethnicity, no bumps, no lesions. We're going to do skin turgor. The skin is mobile and normal skin turgor. The intercostal angles are less than 90 degrees, and there's no use of accessory muscles, and there's normal depth and rhythm of respirations. And I ask you to stand up for me. I'm just going to go ahead and palpate subclavicle, midclavicular, left and right of the sternum. We're going to go ahead and go down. We palpate all the way down. There's no crepitus present, no sign of TMJ. We're going to percuss those same spots. Hollowness is present. I'm going to look at the apical impulse. It is not visible, and I'm going to palpate the apical impulse. I'm going to listen for 10 spots. Just breathe normally. So there's no adventitious sounds in the lungs, no bronchi, no wheezes. I'm going to ask you to go ahead and turn around for me. The AP, the lateral is 1 to 2. You can go ahead and bend over for me.
Okay.
The spine has normal curvatures, no sign of scoliosis, no sign of kyphosis. You can come back up. The scapulas are symmetrical on the back. The skin is consistent with ethnicity, no lumps, no bumps, no lesions. I'm going to percuss the intercostal angle, and I'm going to palpate the intercostal angles. We're going to go all the way down. There's no edema, no tenderness, no crepitus. I'm going to palpate, I'm going to percuss those same areas. Okay, so hollowness is present when I percuss. I'm going to listen to some spots. Just breathe normal for me. Okay. No adventitious sounds on the bronchi, no wheezes. Go ahead and turn around for me. I'm going to listen to the aortic, the pulmonary, the herbs, the tricuspid, and the mitral. And at the mitral, I'll listen for a full minute to create the apical impulse. I'm going to turn around to my bell, retrace my steps, and there are normal heart sounds present. Okay, so at this time I'm going to inspect your breast area. The nipples are symmetrical, there's no drainage, the areola is slightly darker than the surrounding tissue. I'm gonna ask you to lay down for me. Okay, and at this point, I'm gonna put you in a 45-degree angle. We're gonna look to the right, and I'm going to assess the jugular venous pressure, and there is no present. And then I'm gonna ask you to lay down flat and put this pillow up under your shoulder, okay? So at this point, I would palpate the areola, and we're gonna do it in a clockwise method starting from the areola to the outside tissue, and then we'll palpate to the axillary area as well. This is called the concentric method, and I teach you to do this in the shower at the same time every month and report any abnormal findings to your physician. Okay, and I'm going to inspect your abdomen area. There is skin is consistent with ethnicity, no lumps, no bumps, no lesions, normal skin turgor. It is warm and dry. I'm going to auscultate. Okay, I'm going to auscultate. Okay. Normal bowel sounds in all 4 quadrants. I'm going to percuss. Tympany is present with dullness over the organs, and I will palpate. Any tenderness? No tenderness, no masses. Okay. I'm going to do the inguinal femoral area has no bulges. In the genital area, the hair is evenly distributed. The penis is intact, no drainage. There's a testicle in each sac, and no odor. Okay, I'm gonna ask you to turn over and bring your leg up. Okay, the rectal area is slightly darker than the surrounding tissue. There's no drainage, no sign of hemorrhoids, and when was your last bowel movement?
Yesterday.
Okay, is that normal for you?
Yep.
Okay, go ahead and sit up for me. Okay, I'm going to inspect your legs. The skin is consistent with ethnicity. I'm going to check skin turgor, normal skin turgor. It is warm and dry. I'm going to palpate all the way down. Palpate your knees, have no sign of crepitus, no sign of tenderness or edema, and then your ankles as well have no sign of crepitus or tenderness or edema. Your capillary refills in your toes within 2 seconds. Go ahead and pull against me. Push, pull, push, push up, push down. Okay, normal strength of the lower extremities. Okay, go ahead and stand up for me. Lift your head up, leg up. Expert, invert it, leg up, expert, invert. Point your toes, twist around, point your toes, twist around. Okay, the patient has normal range of motion of the lower extremities. Go ahead and walk for me. Patient has normal balance, normal gait. Go ahead and do a heel to toe walk on your way back. The patient has passed the tandem walk. And I'm just going to take a minute, make sure that I hit everything. I believe that is it. I want to perform hand hygiene and document my findings.